Hello again. Welcome back, ladies and gentlemen, esteemed guests. Welcome to session 2, our Menopause Policymaking Workshop. I'd like to thank His Excellency, the British High Commissioner, Mr. Michael Tatham, for his presence. This afternoon's session will focus on how to increase awareness and education about menopause among healthcare providers, employers, and policymakers. Professor Harper will be sharing details of the InTune, the UK's first national menopause support programme. We'll hear about how the workplace can support women to ensure that women who are facing menopause are included and they feel well. And finally, we'll discuss how healthcare providers and policymakers can work together to develop much-needed menopause-related policies. I now invite Dr. Andreas Mavrides, the Medical Director of the ISIS Clinic, to officially open the session.
Thank you very much. Oh. Okay. Thank you for coming again, for those who stayed on, and the ones that have arrived now. Good afternoon. And welcome back to session 2 of Menopause and Women's Health event. In the morning, we had those brilliant talks. We heard about the power of knowledge and how we should be informed. Everybody should be informed, especially from an early age, about fertility, women's health, the menopause, and this change in life. We explained how important it is because we're having a growing population, getting older in age, and that means the percentage of women in this at this stage is increasing. We've heard about the HRT, basically that more or less that is generally safe. Some misconceptions that were in the past. There's less. The black boxes have been lifted, and the appreciation to this medication is changing, but not to be abused. Of course, it should be used as a tool. We heard about carbs and protein and lifting weights and overall how to approach and look after our body. This afternoon, we'll be focusing on workplace inclusion and well-being for menopausal women, highlighting the importance of shifting organizational perceptions around menopause and discussing potential policy initiatives to help drive this shift. Menopausal women constitute the fastest growing group in the workforce, currently accounting for 11% of the G7 workforce alone. And this will keep going, as we said, as the world populations age. It is imperative to acknowledge the unique needs faced by menopausal women and develop comprehensive policies to address them. This event was organized to share expert insights, raise awareness, and foster a much-needed discussion aimed at encouraging the introduction of policies that support women throughout their reproductive lives and beyond. Thank you for being here and enjoy the talk.
We're very pleased to welcome back Professor Joyce Harper, who will be discussing InTune, the UK's first menopause support programme.
We got a different one. Sorry. I was trying to be helpful. Thank you. It's a real pleasure. Can I just ask, how many were here this morning? Oh, more than half. Although we had a full house and brilliant energy in the room. From the minute everyone walked in, we had a wonderful audience of men and women, but mainly women, who were very, very motivated to talk about their life and how they're feeling. And it was really, really wonderful. It's been a real pleasure to do that. But I'm going to do a slightly different talk now, just about our UK Menopause Education and Support Programme. So I'm going to show you some of the research that I've been doing over about the last 10 years and where that's taken us. And we want to do this globally. I am sure we can sort this out, you can sort this out in Cyprus, and it will be it will be amazing. It will change people's lives, which is what we want to do. So I have written a number of books, but the book that's relevant today is Your Joyful Year. So that's not the right cover. That's a ChatGPT cover, actually. The real cover, I'm chatting to a couple of artists now about the cover. But what I did is I interviewed 50 women over 50 to find out, they were all thriving and happy women, to find out what were their secrets. What in their life can we be good role models to women to help them all live a good and healthy life, happy and healthy life. So I'll just talk very slightly about it. So, right, let's get on with so just some declarations. I do get paid by people to give talks, but none of that will interfere with what I'm going to talk about today. So sorry, there's a couple of slides that were in this morning, so sorry for the people that were here this morning, but I just wanted to explain where I'm coming from. So in 2019, I helped set up an international reproductive health education collaboration because I was very aware that there was some brilliant research being done in different countries. There's some brilliant people that have been working with us, and Christiana's one of our team. There's some brilliant people doing different pockets of work in different countries. Most of the work that people have done so far has been around fertility. So it's helping people understand about their fertility. And menopause has not really been addressed, but I think that menopause is absolutely part of there. So for me, it's all about our reproductive health from puberty, actually slightly before puberty, till the day we die. Because our reproductive organs are all still there. We've still got them. Women won't have periods anymore. Men are still fathering children, as we were discussing this morning. But for women, our bodies will change. And we do have to appreciate that women are very, very different to men. There's a saying going around now, women are not small men. Yeah, we're not small men, okay? We are more complicated, and we're embracing our complication. So we have our menstrual cycles. At puberty, boys will start producing sperm, girls will start producing eggs, but then we have a menstrual cycle, we have a period. We are the ones that get pregnant, we are the ones that experience the miscarriage, and then we have the menopause. So guys are just doing their stuff, and we're doing all this complicated stuff. And as I said this morning, we've got these complex and powerful reproductive hormones that are having an effect on women all around that. So let's get into some of that. So our reproductive health education has mainly been around fertility. It's been work in schools, etc. But I'm going to concentrate on the menopause part of that. So InTune, my wonderful co-worker, Shima Tariq, she's a consultant. She works in mainly HIV, supporting women with HIV in the UK. She's worked in this field for almost 20 years. She came up with the brilliant title, InTune. We were going around in 100 circles, and I'll tell you, AI did not help us at all find a name. Come and find us a sexy name of what we're going to call this program. But Shima came up with this. So this is how she got it. We always have some extended way of how we can make a nice word. But InTune, as I said this morning, we want women to be in tune with their bodies, in tune with their menopause. And I also want you to keep at the back of your mind that we can absolutely roll this out for fertility. So I will add in there in tune with their fertility and then in tune with each other, because I think women working with other women is really, really important. And peer support, as you'll tell you, peer support of women supporting other women who are going through a slightly different but similar situation to them is really important. It's at the heart of what we're doing. So this is our group. There's Shima next to me. I don't know if you can read her T-shirt, but she's quite a controversial character. I'll just tell you, in our fertility education, we made this poster in 2019, and it was a poster about what we wanted young people to be aware about their fertility. When we made that, myself and someone called Dr. Karen Hammerberg, who's a really big fertility expert in Australia, we sat in our offices and we thought we would write what young people should know about their fertility. That was wrong. We did something wrong. We weren't involving any of the people we wanted this to be designed for. And that's when I really learnt through that incorrect lesson that we need to co-design. If we're going to make any information or any education or support for any population, the number one is we co-design it. So we get those people in the room because, okay, we thought, well, we know about fertility, but we don't know what language and the way young people or menopausal women or whatever want to hear this information. We're biased because we have known this topic for decades. So we are not at the right level. Our brain's not at the right level. And again, with menopause, we might think, oh, well, we know about menopause. We're going through it or whatever. No. We need the public. We need the public involved with this. So that's what we did. We co-designed it. And I'm not sure how much of an issue this is in Cyprus, but I think it is still an issue everywhere. We need to be inclusive. So at the top of that, things like different cultures, but we've also got now neurodiversity. Neurodiversity is massive in the UK. I'm sure it's here or coming soon. And a lot of women being diagnosed with things like ADHD around the perimenopause stage, whether it's bringing that in or whether we're just becoming more aware. I mean, I'm a super hyperactive person. I'm pretty sure I'm on the spectrum. I think probably most people in the room are on the spectrum somewhere. Yeah, I can see nods going on. We are. I think it goes with the job. Don't point at anyone, but we are. So I'm not sure why, but it really is quite a trend that perimenopausal women are realizing. And then that's actually something that's really changing their lives for the better because then they're understanding what's going on. So we've talked to women who are neurodivergent, people who are disabled. So how a woman who's deaf or blind or physically disabled will have a very different experience to one who's not. So different cultures. Women who are in a same-sex relationship. We've got the whole LGBT community that in the UK is big, so we need to consider them. There's so many different types of women. So one criticism about a lot of the work that's been done so far, it's for the Caucasian middle-class woman. There's a lot of that out there. What we need to make sure is that we've included everybody. So here, you've maybe got rural communities, you've got communities in cities. They're going to have different types of lives, and we need to consider them. So this is one of our first workshops we did. I'll show you exactly what we did in a moment. We tried to get loads of different people together. We have published a couple of papers on our work. One was about a survey, I'll tell you about in a minute, that we did to say to people, right, we're going to develop this program. What do you want it to look like? What do you want us to tell you? I mean, it's difficult to know what you want to be told if you haven't been told what you need to be told. But we've done a couple of papers. They're all open access. So I'm going to explain to you the route to do this. But what we've come up with is 2 programs. Be prepared for menopause and be supported through menopause. So I mentioned them earlier, but now I'm going to tell you a bit more about them. So this is my research that has led to where I am now. So I've published 9 papers just on menopause. We started with a few surveys at the top. I did surveys and we broke it up into when we published about perimenopause and postmenopausal women. The top right is a survey. Where's it gone? No, in the middle. In the middle is a survey we did with women under 40. I wanted to know what women under 40 were thinking about menopause. The comment I got from a lot of women under 40 is, oh, we're too young for menopause. Why are you asking us? And I was like, what? Why am I asking you? Because I want to know what you think about it, because it's coming. So what do you think about it? And something I will say a few times, we have created, certainly in the UK, a hugely negative view of what's going to happen in the perimenopause. And now I can tell you a lot of the young women told us they're frightened. And now menopause has become like a disease. It's a terrible thing that's going to happen to you. So when you tell a 42-year-old woman that you're starting to get symptoms of perimenopause, what do they say? No. Because they're associating that with aging. And, I'm going to become an old crone, a dried up, wizened old woman. No. So I am absolutely fanatical about changing this narrative around menopause. I briefly mentioned it earlier, but I'm going to mention them all. And these are all the wonderful people that have helped with this work. So a little bit of data. So on some of these figures, the result on the left is the under 40s survey that we did, and the one on the right is the over 40s. So in some of them, we stipulate which age you should be filling in this survey. Where should the menopause be taught? Top result for both of them was school. And I'm going to come on to a bit more work about that with on schools. Second one was doctor's surgery, and we discussed this a lot. Is it really, though, the doctor's role to, in the UK, you get 12 minutes to talk to them, normally about one symptom, unless you go private and pay lots of money. But then we're back to the middle class white woman. So for most people, it's a 12-minute consultation. You're only supposed to talk about one symptom, which is a little bit problematic in the perimenopause. And is it really the doctor's role? So people who are doctors here, is it your role to educate about the basics of what menopause, what we heard this morning, what menopause is, what the symptoms are, what the treatments are? I don't think it is really the doctor's role to do that. And it comes up in every talk I give. Oh, the doctors could do this. I don't think the doctor should do that. Apps are a thing, certainly. Contraception clinic, university, etc. But number one is school. So we've done a lot of work with school kids. I'm not going to go into all of it, but we've done a lot of work. And this was a list of questions on a survey we did with 16 to 18-year-olds. And we have repeated this in Greece, actually. We had this whole list of different topics. And we said to school children, have you learnt about these topics in school? So that's the blue bar. And then the orange bar was, have you looked for information about that topic outside of school? So let's look at menopause. So menopause, it was just over 10% had learned anything at school about menopause, which is not surprising. But look, I think it's 40% of teenagers had looked for information about menopause outside of school. Now, we haven't asked them why. Why did they do that? Was it their mum? Was it their teacher or whatever? But they are interested in this topic. Now, in the UK, I'm doing some work on this, but I'm looking at different school curriculum about reproductive health in different countries. I think the UK may be the only country in the world that actually says we need to teach about menopause in school. So this is from our Department for Education. They have said we need to teach the facts about reproductive health, including fertility and the potential impact of lifestyle on fertility for men and women and menopause. So it's a terrible sentence. It's a long story, but menopause was added on at the end. It's fine. Listen, I don't care. That's why it's such a badly constructed sentence. But it's there. It's in the curriculum that we've got to teach menopause in UK schools. So we're working on it. We're working on helping teachers do that. So I keep joking, I'm going to retire when in schools, everyone has learnt about menopause. I might be dead before then, I think, probably. Good reason to write a book about death. But also, when I ask this question to women, I've asked them how were they taught about this in the service, not at all. But I want this to change. How informed about the menopause did you feel before age 40? So I've also joked, I'll retire when all of them say very informed. Okay, it's pretty low at the moment. I better hurry up and do some work. So I don't want to see that most women are not informed at all. So around the age of 40, when this is going to start affecting their life, they're not informed at all. That is not acceptable. So this was asking them, where are people getting their information from? And this was something that we did in schools. So schools was very mixed. Family members, friends, boyfriend, girlfriend, doctor was low. Internet and social media for young people is obviously high. But even for the women, health professionals was one of the top answers. And then they want to go to the society website. So things like the British Fertility Society, British Menopause Society, International Menopause Society. Social media was only 33%, but it's really influential in the UK. Really, really influential. I'll come back to that. This really upset me. If you looked for information, when did you look for it? As my symptoms started, 68%, not ideal. It should be before. But this one, 17%, a long time after my symptoms started. Not acceptable, is it? So you know what? The women, they had a free text where they could write anything they wanted to. So we've got thousands and thousands of comments from these women. Because through all the surveys, I think I've probably, with focus groups, interviews and surveys, heard from about 7,000 women. So we've got a lot of quotes. Okay. The biggest thing they said was that they thought they were going mad. They thought they had dementia. They thought they had cancer. They thought they had arthritis. All of those things because they just thought menopause was hot flushes and night sweats. They didn't know about all the psychological issues and all the other things that could happen to them. So they took years to realize that actually it was the perimenopause. So this is one of the main reasons why we have got to be sure women before the age of 40, and even doing it at 40, we are going to miss some, but I think around the age of 40 is a really good idea to make sure that, again, before I had symptoms is 100%. That's what I want to see. So I've got some big aims. So what the women said, of all the research I've done, they've said lack of education. They had no idea and it has impacted their lives. And one of my favourite quotes, the lack of information is shocking. I didn't know the symptoms, so didn't join the dots until I spoke to a friend. We are both nurses and we didn't know. So how does anyone else supposed to know? I mean, this is not acceptable. We have to do it now. Now, they also had a problem with their doctors, and apologies, the people in the room, I always say, are the ones who are enlightened. It's the people who are not in the room that are the problem. And in the UK, they have said that their GP did not seem to understand the menopause and they had a lack of support. So very common comments were, I was 49 and my GP told me I was too young because I'm not 51. Yeah, exactly. 50. So we saw earlier, 51, 52 is the average age the woman will stop her periods. And we saw at Effie's side, 45 to 57, she wrote, was the time that can happen. So stopping your periods at 45 is not young. That's within the normal range. The symptoms, the perimenopause symptoms happen before that. So late 30s is not too young. That was the most common, was that a GP sent them away in their late 40s and said, you're too young, go away. Wait till you're 51, which is insane. Now, in the UK, what we have now got, we've got some GPs who want to make everything that happens to a woman over 45 due to her perimenopause, and we heard that this morning. Sometimes it's other problems. It's thyroid problems, depression that's not hormonal. There's a whole list of things that happen to women, obviously because of aging, that's not due to her menopause. And I have heard some people give talks that suggest that everything, even in a conference, everything that happens to a woman over 45, all her cancer, everything is all due to the menopause. It's all hormonal. Do you know what? That's not true. We have a lot of things that can happen to us that are not due to our hormones. So we have those, everything's due to your hormones, we'll just give you HRT and you'll all be great. And then we have the other end that still talk about, as we heard this morning, that this women's health study that was done that said there was some risks. And they were like, no, you must not go on HRT, it's the devil and you're all going to get breast cancer and everything else. So we've got GPs at either end and then some in the middle. So it's really, really problematic. So the British Menopause Society has been doing a lot of work in trying to educate GPs and all health professionals with evidence-based medicine. So they started a new way of framing their education program last year, but we've got a long way to go. We've got stigma, we've got taboo, and women feel forgotten. So I did show this slide this morning. Apologies for anyone that was there, but we were talking about this at lunch. It is the Wild West out there because women of this age have a bit of money. Big Pharma would love it if we were all sick and that they all had to give us HRT because it's or some supplement. It's the only way we're going to be able to thrive. Women actually live longer than men at every age group. Can I just remind everyone? You know, we stand the test of time. Anyway, but we're all sick apparently. It's big business. We're not small men. We're an improved version. We are the default. So brilliant marketing. This stuff is brilliant. How many people in this room have or how many are already buying menopause supplements or have hovered over buying something when they're scrolling at 1 o'clock in the morning and thinking, oh, look at this, these people all look fantastic and they're all saying it's fantastic. It's got a great rating. I should do it. It's going to make me look younger and, oh, goodness me. And I'm going to show you some of it. It's all sold on testimonials. It's all said it's sold on science. It's all said it's backed by science. So I think we are already exploiting women and we're not empowering women, and we need to readdress that. So we joked this morning about the menopause chocolate and the tea and the clothes and the supplements, and Gwyneth Paltrow sticking everything up our vagina that she can think of. She does, steaming your vagina. Oh my goodness me. Anyway, we won't go there. And then one famous doctor, you can read in very small letters there, but don't get her to sue me. This is from her website, that she feels that menopause is a disease and that we're all sick. So, some of the supplements, I've been doing a lot of work on supplements. I'm working on fertility and menopause supplements, backed by science. Look, they're shining. It has these lovely, smiley white women in their kitchen. Look what we made. We're going to feel better. Oh my, it's marketing, it's amazing. Clinically proven, multi-award, everything's an award, won an award. Right? Look at these lovely, God. These are the testimonials. I'm not sure they'd be selling it to me, actually. It's an award winner. This is one of my favourite quotes. This is a firm favourite, but the price tag does reflect its high quality. So you can pay us extra money just because we've got a little bit more clever with our marketing. That's a con. It's all a con. So the people are on it. We had a panorama programme that was on it. People are talking about it in the paper. 1 month, the top 10 menopause supplements on Amazon generated over 3 million. This is big business. One of my friends at the gym, she's in her 40s. She said, oh, Joyce, I want to know which menopause supplement to take. She said, my friends are on one. She pays £93 a month. I said, please don't take it. I said to her, what are your symptoms? And if she told me she had any symptoms, you know what I was going to say? Go see your doctor.
Yes.
Yeah. Don't self-diagnose and take some supplement. So we have done a study with Anne-Marie Boland, who's a professor in Oxford. We've done a study looking at the ingredients of menopause supplements. You'll love this one. So we looked at the vitamins in them, the minerals in them, other active ingredients, and then the number of it. Actually, there's a lot more in this paper. This paper's been submitted for publication. Some of the supplements just had one thing in, but some of them had 40, I think the top one's 45 or 46 ingredients. Anyway, there's a lot to say about all of this. Just to say that the one vitamin that the British Menopause Society recommends that women take is vitamin D. And only 54% even had vitamin D in. That's the one recommended. And almost half the supplements don't even have vitamin D in. We were at an event recently, a menopause event, and the woman was really selling us this thing. And I said, why haven't you got vitamin D in? And she went on this whole spiel about it. It was just incredible. I didn't almost buy it. But we've got to be careful with things like the minerals, zinc and magnesium and things. We've got to be careful. So some of the doses, we've got graphs about the doses of these. Some of them had minuscule amounts in that aren't doing anything. And some of them had thousands of times the dose of the daily recommended amount, which can be dangerous, yes? Can be dangerous. And are they deficient in any of these? No, they've never been tested. They're just taking it because it's great marketing. And so it really, really worries us. Really, and some people are taking 2 or 3 of these and paying a fortune. So this is just one example of the Wild West. Really, it's crazy. HRT as a preventative medicine. So the FDA recently said that HRT will reduce the risk of dementia and heart disease. And osteoporosis, yeah, we agree, and we heard that this morning. But dementia and was it everyone or was it you that said the heart disease is complex? Yeah, you said.
Evidence on it.
Yeah.
Only it started, the ones who were in the morning, within the first few years when you have symptoms and under the age of 60, and there is absolutely no effect, and there is no evidence to say that it is of any benefit at all beyond the age of 60. So we shouldn't be drawing it.
Yeah, exactly. But the FDA said, and actually what it is doing is lowering some of our heart risk parameters, but whether it's actually stopping you dying of a heart attack, we don't even have that. So that's, to the public, that's too much of a subtle thing. And the dementia, so Professor Pauline Mackey, who's been doing all the research on this, has been now gone on to Instagram, which she never did before. She's brilliant. And she's been saying, this is my research. There is no evidence that taking HRT will reduce the risk of dementia In the women I interviewed for my book, 2 told me they had no menopause symptoms. They were taking HRT to reduce dementia. It's a big thing in the UK. It's misinformation. If I thought it would reduce, my mum had dementia. If I thought it would stop me getting dementia, I would take it, and I'm not taking it. So, but we have Sue Mann's one of our NHS Superwomen, and Susan Davies is the one that does all the testosterone research. Susan's been on my podcast as well. So the American group said they recommend against the use of it as a primary prevention of chronic conditions, and the British Menopause Society said it should be individual. But this is big marketing. Big Pharma would love it if every woman over 50 was taking HRT till the day they died. They would absolutely love it. And I know you're going to discuss menopause in the workplace soon. It's really important. My university doesn't have a menopause policy, and I'm on it, but I've been on it for years, and I keep hitting brick walls. I've been told there's too many policies, and we don't need another one. By a woman, actually. I got into a bit of trouble because I was a bit outspoken. We're writing menopause guidance. No, it should be a menopause policy. Anyway, I'm working on that. So women, there's a lot of data about women wanting to change their job. They're fed up with their job. I think there's 2 parts of this. I think some women now feel empowered at this stage to say, actually, I don't like this job. I'm not leaving because I'm just leaving because I don't like them. I think they do that with their husbands as well. We're blaming menopause for divorce. I think they look around there. Actually, I don't like you. I'm going. So it does give women a superpower, but some women are leaving because they're bullied or they're not supported, which we don't want. We definitely don't want that. So we want to support them. So Andreas said this morning there should be more men in the room. That was a Freudian slip. There should be more men in the room, not the womb. And I do a lot of talks to corporates, and there's normally like one guy, and the women all say, "We're going to buy you a drink, Eric, because you're great. We're going to take you out because you're here. We love you. We need the men, because the men need to support the women, and they need to understand that if a woman's got a bit angry." It wasn't them, actually. It was their menopause. And if they're sweating, they need some support. So we'll talk about that later. And periods. The periods can be really horrendous at the end and really painful. Some women need to work at home because they're just flooding. I've got some stories from the women I've interviewed for my book. They're just horrendous. So this is myself and Shima. We've done a lot. We've got quite a lot of media coverage, a lot of TV and radio about this. So this is what we've done. We set up an expert advisory group. We had 2 workshops with diverse stakeholders. We did the public survey, which I've mentioned, and we did 11 focus groups with diverse groups of women. So as I said, the neurodiverse, the disabled, early menopause, surgical menopause, breast cancer. We tried to listen to as many people as we can to say, what are your needs? What do you need? Okay, they all need education, they all need support, but a neurodivergent group don't need the same sort of education support as the women from South Asia. Okay, they're very different. So there is not one size fits all. So we have to remember that. So this is our advisory group. There's some really amazing people there. Dame Leslie Regan's she's just done so much around this. She's our ambassador for our women's health strategy in the UK. Carolyn Harris is a brilliant women's health MP and advocate. She's amazing. Geeta is part of the Royal College of Obs and Gynae. Janet Lindsay is the CEO of Wellbeing of Women. Anissa Mukherjee's written brilliant books on this, and I've mentioned some of them already. So we had a really diverse group of people. We had partnership we have a charity in the UK called Wellbeing of Women. They're fantastic. Sophia Forum is a charity on HIV that did a lot of work on menopause for women with HIV that Shima worked with. And we had support from the British Menopause and the Royal College of Obs and Gynae. And then listening to all of those things, the 2 programs are the Be Prepared for Menopause and Be Supported Through Menopause. So this is what I think we can do in Cyprus. So Be Prepared for Menopause. From this, I won't go into how it all came about, but we made 18 short videos with these people. These are very short videos. They're literally, some of them are 2 minutes. The ones at the end are actually 1 minute. And these are all experts that told us what is menopause, the symptoms, lifestyle. This is about preparing. So trying to sow those seeds about your nutrition, your sleep, your exercise now. And what do women say? We don't have time. Okay, we've got to understand that if we are living the life of a woman now compared to 20, 30, 40 years ago, it's so different. We have to make the time to look after our health if we want to be healthy. It's our decision, it's in our hands, but we need to give the women permission to do this. We need to tell them. A bit about diagnosis and treatment, when you should visit your GP, so what sort of things you should say to your doctor, and then life post-menopause. So the 4 women at the end, they were all interviewed for my book. They all do a lot on menopause. They've all written a book about menopause, and they are on at the end all saying, post-menopause has been the best time of my life. That's basically what they say. So Rachel Lancaster says, since I'm no longer fertile has been the most fertile time of my life. She says it much better than that, actually, which is true. It's true, but we need to tell people that. We need to show them that. So when I've delivered this 6 or 7 times, no, 7, more than that, quite a few times live around the UK. And it starts off really good. The cycle of change is a brilliant animation, listening to women sharing their stories. But then when we get on to the symptoms and the lifestyle, the energy in the room goes, I'm like, oh my God. And then we have these 4 wonderful women at the end saying, whee! And I'm like, oh, thank God. It lifts up. I want people to leave feeling a bit more motivated. I don't want them to leave in the middle when we're like really low energy. So that takes about 2 hours to do. So I show a video and then we have a chat. And then we show the next video and then we have a chat about how it affects the people in the room. I'll tell you a bit more about that in a minute. So being supported through menopause, when the women actually have the symptoms, when they're actually in it, we need them in the room, ideally, with other women, like the pregnancy classes that some of us went to. It was so amazing to be with women who are experiencing similar but different things to us and being in a room and learning more. So we want to teach them about treatments, lifestyle and discussions with the doctor. So much more in-depth. From what they've told us, maybe about 6 weeks, 6 evenings or whatever, they want education and they want peer support. So finding that sisterhood and that peer support is really, really important. So we've got someone there doing this online. Our vision was really to have people face-to-face. I mean, the energy when you have someone face-to-face. But we have been trying, we have literally spent all of this year, I've lost count of how many meetings we've had with different people about how we can apply for funding to support this work. The long story is, in one sentence, we've been advised that we better first do it online. So I still would like to do it synchronously and asynchronously, so we could have some of it where it's all pre-recorded, but then we're not going to have that discussion, but somewhere we do it where we just do it online, like I would deliver a lesson online. So it's live, we show them a video, then we still have the discussion, but it's done online. I've done a lot of focus groups online with women at all different stages, and they work well. There are advantages and disadvantages of both. The trouble with the face-to-face, how do we roll this out across the whole country? We would have to train so many trainers. We'd have to monitor them, check they weren't going off at some weird tangent. We were talking earlier about the holistic doctors telling you should be doing all weird things. You know, how are we sure that they haven't done something? So that is, for funding, really, really complex. If we do it online, it's much easier. We can hit a much bigger audience. And if people are telling us they don't have time, do they have time to travel to their local library or doctor's surgery to go and have one of these sessions? Maybe not. So who would deliver it? They don't really want their doctors to do it. They'd want maybe a nurse or counsellor or whatever. So that could really vary. Will women attend? There was lots of people that came today, so that's good. And then we're academics, so we need to test the intervention. We need to make sure that whatever we do is actually having a positive effect. Because we might think it's not, but it is, but we need to be sure. So we want to look at primary outcomes, things like measure of the menopause-related quality of life, And there's some ways of doing, accredited ways already, validated ways already doing that, like Menqual. Or we could look at menopause health literacy, and we're working with Professor Amy Spector now to develop a menopause health literacy. Uptake of HRT as well. I wouldn't want, if everyone went on HRT, I'd get worried. I think we're doing something wrong. So there's loads of theirs to unpick, but this is where we've got to now. And this has basically been 3 years, really intense work and so many discussions. We have gone round in so many circles in this. I won't bore you with it all, but it's been hard. So how do we actually deliver it? There's a lot out there in the press now. We know there's a menopause education gap. We know all these things. So in the UK, the government just announced a few months ago that we have an NHS check at age 40, and they have said they're going to add in there for the first time a conversation about menopause. But they will not have time to educate the women. It takes me 2 hours to Be Prepared for Menopause. That's not going to happen in your doctor's surgery, as I said. So what we want them to do is we want to set up our Be Prepared. If we do it online or through a website, then the doctors at the 40-year check can say, right, go, or even before they come for the appointment, they get the appointment through, before you come, can you please go and have a look at this website and run through the program of Be Prepared for Menopause? Can you imagine if before a woman came to talk about her symptoms when she's having the symptoms and whether she wants to go on HRT, if she'd actually already done the Be Supported Through Menopause program before she came to you? Oh my goodness me! What a different conversation. So that's my fantasy. I've got a lot of fantasies about what I think I'm going to do in the next 10 years before I die. So I don't know how that could work in Cyprus. So we've done a few webinars for World Menopause Day. We did one last year. Last year, the theme of World Menopause Day was HRT. So we did one on HRT. This is my YouTube channel. This year, I was so happy. It was lifestyle medicine. So we had a brilliant team of people that came and talked about lifestyle medicine on a webinar. So take-home messages. I think we all agree. I probably made a mistake there. I shouldn't say women. I should say everyone. Everyone needs education. Health professionals need education. We know what we want to deliver. We've listened to the women, and they've told us now through our surveys and focus groups and everything else what they want. How we do it, online, face-to-face, through employers. That's the other thing. We can do it through employers, and there are some companies already doing that. But they haven't co-designed them. We want to improve everyone's quality of life, and we want to be sure that at home and in the workplace, their life has improved. So I do have a podcast. Why didn't anyone tell me this? I've interviewed lots of people around menopause. My big theme has always been that I want to encourage good health and happiness, and we need to do it. At the 40-year check can say, right, go, or even before they come for the appointment, they get the appointment through, before you come, can you please go and have a look at this website and run through the program of Be Prepared for Menopause? Can you imagine if before a woman came to talk about her symptoms when she's having the symptoms and whether she wants to go on HRT, if she'd actually already done the Be Supported Through Menopause program before she came to you? Oh my goodness me! What a different conversation. So that's my fantasy. I've got a lot of fantasies about what I think I'm going to do in the next 10 years before I die. So I don't know how that could work in Cyprus. So we've done a few webinars for World Menopause Day. We did one last year. Last year, the theme of World Menopause Day was HRT. So we did one on HRT. This is my YouTube channel. This year, I was so happy. It was lifestyle medicine. So we had a brilliant team of people that came and talked about lifestyle medicine on a webinar. So take-home messages. I think we all agree. I probably made a mistake there. I shouldn't say women. I should say everyone. Everyone needs education. Health professionals need education. We know what we want to deliver. We've listened to the women, and they've told us now through our surveys and focus groups and everything else what they want. How we do it, online, face-to-face, through employers. That's the other thing. We can do it through employers, and there are some companies already doing that. But they haven't co-designed them. We want to improve everyone's quality of life, and we want to be sure that at home and in the workplace, their life has improved. So I do have a podcast. Why didn't anyone tell me this? I've interviewed lots of people around menopause. My big theme has always been that I want to encourage good health and happiness, and we need to do it. That's my team, and that's my social media. Thank you.
Thank you, Joyce, for the very valuable information. I would now like to introduce Ms. Mahi Solomou, Certified Menopause Champion and member of the AIPFE Board of Directors. Mahi is actively involved in promoting menopause awareness, encouraging workplace inclusion and policy advocacy.
Good afternoon, everyone. We've heard a lot about science. We've heard a lot about research. It's now time to talk about all those women with the menopause symptoms having to go to work every day, and there is a way around it. And this is what we're going to highlight today, the importance of support in the workplace and navigating these symptoms. So let me be frank. Menopause in the workplace can feel a lot like preparing for a super important presentation to the board of directors. A little bit of anxiety there, a few nerves. Add on that some brain fog, which can make you even forget your CEO's name. Followed by a hot flash that leaves you drenched in sweat and embarrassed. Welcome to today's survival guide, owning menopause with confidence and navigating these challenges and understanding what is a natural life stage. We've heard earlier that there's 1.1 billion women worldwide currently experiencing the menopause, and this is more than just a statistic. It is a powerful reality that calls for a profound shift in how we perceive and support menopause, not just in the workplace, but in society as well. This 1.1 billion includes women like us, leading teams, making crucial decisions, and supporting each other on a daily basis. And trust me, menopause does not discriminate. It can affect anyone from a CEO to a nurse, a doctor, an officer, everybody. So as a certified menopause champion at the British High Commission and someone who has personally navigated a very challenging perimenopause journey, I'm here to share insights and advocate for a workplace culture that embraces and supports women through this natural life stage. So let us explore how we can create environments where we can not only thrive, but own our menopause journey with more confidence, less shame, and less silence. Woman's life cycle, we've got puberty, we've got pregnancy, and we've got the menopause. So consider these three very significant stages in a woman's life. Have we got any parents of teenagers in this room? Any mood swings, any ups and downs? Do we ever give excuses for our teenagers? It's the hormonal changes, it's okay, leave the child alone, okay? So admittedly, puberty and pregnancy are often met with excitement, curiosity, and a welcoming sense of empathy about the hormonal shifts. Why does menopause carry a very different narrative? Menopausal women are too often labeled as spaced out, sick, or crazy. Heard this before? However, menopause is a natural stage, and it's marked by hormonal shifts that significantly impact both our physical and mental health. Despite the progress ignited by what we know as the menopause revolution, championed by public figures like Davina McCall, the topic remains largely hushed to this day. This was back in 2021, and many women continue to suffer in silence, facing the stigma that prevents open conversations and proper support. And I hope that the time has come to move from taboo to table talk and give menopause a more powerful presence. I'm not going to go through the symptoms in detail, but I'm only going to say that symptoms such as hot flashes, anxiety, sleep disturbances, and brain fog can significantly impact our day-to-day work. So menopause symptoms can obviously have a direct impact on productivity, job satisfaction, our self-esteem, and concentration. And understanding these realities is essential for creating a supportive workplace environments that acknowledge the profound impact that these symptoms can have on us, on our well-being and our performance. So how does this impact our work? There's a depletion of estrogen, as we've heard before, and this throws a curveball in our life. And our brain cells, they start to unplug, and it's what we call brain fog. I could be talking to you right now, and I could forget the most simple word, maybe menopause, which is my topic of the day. If you have difficulty sleeping the night before, you will obviously have lower energy, inability to concentrate. And here I want to give an example because I've attended a number of seminars, webinars, etc., through the Foreign Office. And there was a police officer on one of these webinars, a male, and he spoke about his personal story with his wife. And he said there was a time that my wife was having difficulty sleeping. She was having hot flashes, and that affected me. So one day that I had a very important presentation, I had to call in and tell my manager, my supervisor, I'm not able to come into work today because I hardly had any sleep last night. So this is a very powerful example of male allyship. So hot flashes can be hugely embarrassing during meetings. There's also higher intention to leave the workforce and hesitation to seek promotion. We'll see some data from the UK a bit later on. In worst case scenario, our colleagues are oftentimes unsuspecting. So how would they be able to help us without knowing? We'll also see some data, again from the UK, about the economic impact. 1 in 4 women have considered leaving their job, and 1 in 10 actually do. Nearly 900,000 women in the UK have left their jobs in 2023 due to menopausal symptoms. And if we consider that the UK has 68 million, pretty much, in population, menopause results in the loss of 14 million working days annually. And this costs the economy 1.8 billion in productivity sterling. And this is information from the Department of Work and Pensions. Around 50% of women aged 50 to 64, they work extra hours. Why do you think that is? They feel bad they feel they're not producing up to par like they used to. And 27% of women report that menopause has negatively affected their career progression. And according to a BBC poll, 70% of women had not disclosed their symptoms, going back to the shame and silence. Before I go to this, just to say that this significant loss of working days and productivity presents a major economic and social challenge in the UK, and not only. I mean, I have access to UK data. We don't have similar data in Cyprus, but it goes without saying that it applies to other countries as well. So think menopause-related absenteeism, reduced working hours, premature retirements, etc., etc. Hence the urgent need for workplace support. I saw that Helen Tomlinson was in the advisory board earlier. So Helen Tomlinson, first to say that few European countries have formal policies supporting women experiencing the menopause. And in March 2023, Helen Tomlinson was appointed as England's first independent menopause employment champion. And since 2024, Mariella Frostrup has taken up this role. This is a voluntary role, and it involves engaging with employers and government departments to advocate for menopausal employees in the workplace. The ambassador supports employers in developing policies to foster a supportive environment. And this is something that we're hoping to have in Cyprus sooner than later. So Helen Tomlinson continues to be head of inclusion and employability, and she emphasizes that menopause is not a reason to step down, step back, or step out of one's career. And she highlights the importance of comprehensive support. Education, allyship, things that we've mentioned before, sharing lived experiences, because this encourages other people to do the same, and active leadership so as to empower women during this phase. So she talks about multifaceted inclusion, highlighting that every woman's menopause journey is different and unique and requires flexible and more individualized support. Inclusion is key, obviously. And while policy is essential, it is culture at the end of the day that determines its success. The FCDO stands for Foreign Commonwealth and Development Office. So the FCDO menopause policy was introduced in 2022. This policy is not just in the Foreign Office, it's also in other ministries, and it aligns with the dignity and respect at work policy. And it applies to all FCDO staff, both in the UK, but also at overseas posts. Hence why the British High Commission as an overseas post, we get to benefit from this. Hence my knowledge on this subject matter and the training that I've done around it. It's mainly via the FCDO and UK sources. You've heard a lot about the UK, but what are we doing locally? Both the British High Commission and IPFE Cyprus-Women of Europe, which I'm part of the board of directors, are working to elevate menopause on the national policy agenda. And I'm glad to see Savia Orfanidou in the room today because this is a conversation that we've had. There was a letter that went out to the Ministers of Labour and Health, the previous ministers. We still have not received an answer, I understand, since May. I then was asked to speak openly about the FCDO menopause policy. And I am really happy to say that the Department of Work and Pensions and the FCDO have granted us the brain fog, they've allowed us, they've enabled us, they've given us the green light to share the FCDO menopause policy with the Cyprus government. So hopefully we have already requested as British High Commission a meeting with the Labour Minister, and hopefully this will happen sooner than later so that we can share best practices. So our efforts include engaging with government departments. Our president and vice president, who are both here today, have met with organizations such as OEF, GEVE, YESI, and also sharing the menopause policy that I've mentioned earlier. So some recommendations that Professor Harper has already mentioned. And these recommendations, you might think, okay, there is no official menopause policy, so what do we do? So your organization may not have these menopause-specific policies, but you can use existing policies on mental health. It could be a policy on wellness support or flexible working, and you can adapt those to address the challenges of menopause. And to be an effective advocate, it is important to remind employees of their rights and the available benefits. So we're talking about a written policy and a protocol. Despite the fact that there is an FCDO menopause policy, I have created a protocol for the British High Commission, which had, of course, to be approved by management. So just to very quickly say what this is all about, you go through things like the symptoms, the impact that it has on employees, and what can we do, these recommendations, whether it is a support group that you can have at work, or having desk fans if it's an open space, etc., etc. Support group is very important, and it's something that you can easily do at your organizations as well, led by somebody who understands the menopause. You don't need to be a medical expert or a doctor, and obviously you're not going to tell people, take HRT or take magnesium, but you can direct them towards resources, and we've got a lot of resources at the High Commission and the Foreign Office in general. Obviously, hybrid and flexible working, if there is the need to, going to work at 9 one day instead of 8. Encourage conversations. Most importantly, share your menopause journey, something which I will do shortly. The first time that I shared my menopause journey, it was in front of an all staff, and I was in tears. I was in tears because I was recalling a period of time where I had suffered in silence for far too long, wondering what all those mystery symptoms were all about. And I truly thought that my male colleagues would get up and leave, and it's the ones who actually not only stayed, but they came in my office later on to say, my partner, my spouse, what do I do? Temperature and ventilation. Obviously, if you're in an open space, fans work. You mentioned before the flash period, so we also have product placement in bathrooms. And there's physically demanding roles. We're doing this event with ISIS today, so you have nurses, physically demanding roles. So we're talking about, if their uniforms, for example, are the material is not suitable, you will just go to something more appropriate. This is really me before my menopause. And as a sign of vulnerability and to share the deeper purpose behind my work and the advocacy on menopause, I will share my personal journey. Until 3 years ago, at the age of 51, my perception of menopause was no periods and hot flashes. We know now that there's over 100 symptoms. My perception of it was only 2. And for months, I struggled to make sense of all these symptoms. I had been a long-distance athlete for over 2 decades, and suddenly I was experiencing fatigue, heart palpitations, joint and muscle aches. My sudden excessive weight gain certainly wasn't helping, and my GP suggested several tests for thyroid function, B12 levels, iron, etc., etc. Yet, frustratingly enough, nothing seemed to be wrong with me. I was admittedly not a spring chicken, but I couldn't help but wonder, where did my mojo go? Even cycling had become strenuous as I was getting uncomfortable tingling in my fingers. And my orthopedic surgeon, guess what? He had advised immediate carpal surgery in both arms, something which I thankfully didn't have. You want to hear more symptoms? We're talking about insomnia, itchy skin, subsequent loss of confidence due to lack of concentration, brain fog during meetings that can be hugely embarrassing. But the most devastating symptoms were the mental ones: increased mood swings, irritability, stress attacks, and yes, depression. I was in a very dark phase. I did not feel like I was in my own skin. And I truly felt like I was losing my identity. There were days that I was looking in the mirror, "Where are you, Mahi?" I was literally saying these words. I had alienated myself from most friends and family. I spent endless hours alone, suffering in silence. And even my adoring dog, she hated me during that time, my Luna. So it wasn't until November 2022, following endless conversations with my gynecologist, my GP, and my nutritionist, who's thankfully here today, I was relieved to discover that all of those symptoms were inextricably linked to menopause. I, like most women, was not sick or crazy or old. I was in menopause. And this is what created a new sense of resolve, to empower myself with knowledge and embolden other women. Colleagues, family, and friends, I could no longer suffer in silence, and I had to let my senior management know that my extended leave, which I remember taking over Christmas, was due to menopause. I had not taken sickness leave, I had just taken leave. I certainly did not wish to see any colleague or friend going through a similar experience without supporting them, and I embarked on a mission to give menopause a more powerful presence. I needed to shed light on the fact that menopause can be debilitating for women, as our bodies and brain simply shift to another stage. To alert colleagues and friends in their 30s, 40s, and beyond to educate themselves on menopause long before they get what I call the big bang on their door. And to explain that menopause affects everyone, not just women, a sister, a partner, a friend, or a colleague. I was hugely grateful for the plethora of resources through the FCDO and cross-governmental departments, as well as the Menopause Support Cyprus, a platform that we have here in Cyprus. We've got the founder here. You can talk to her later. which is not only a website, but it's also a Facebook group. And you women there talk amongst themselves, they share best practices, they put questions, some doctors are there, nutritionists, and they also put their advice. And I was soon galvanized into action and embarked on an enlightening journey of voracious learning and self-discovery. It was self-discovery most importantly. So in this voluntary role that I have as certified menopause champion, I continue my education. There's a lot of training, both on the FCDO platforms and others. We established the menopause support group. I don't just speak with my embassy, I also speak with other British embassies as far as Myanmar, Bern, Rome, Paris, and lots more, Libya. And while menopause is gradually gaining a more prominent place in workplace conversations, there remains a significant gap in practical support. We've been talking about it for too long. What we need to do now is move on to the next stage. And many women spend months, sometimes years, navigating the symptoms in silence, especially during perimenopause, that we know the symptoms can be tricky because we do not identify them straight away as menopausal. And these silent struggles, coupled with a lack of adequate support, can directly impact career trajectories, decision-making, leadership confidence, and overall well-being, particularly in fast-paced, high-responsibility environments. And this is why workplace menopause support is not just beneficial, but essential. Ideally, and hopefully in the very near future, every organization ought to have a menopause lead. Someone within the organization who understands workplace demands and recognizes how menopause can affect women, and someone who is equipped to signpost colleagues to relevant resources. The most important thing for me, whether we're talking about managers or staff, is training. Educate yourselves. So line managers obviously play a very important role in fostering a supportive workplace environment. So they need to be aware and understand their organization's menopause policy, protocol, or guidance. And they need to be able to have some kind of understanding to be able to engage in relevant training focused on menopause symptoms and appropriate workplace adjustments. And obviously, staff need to feel comfortable enough to approach their manager and talk about their symptoms. And managers ought to be able to provide a private, confidential, and safe space where all this is being discussed. In the same way, and I will not go into too much detail, training for staff as well. You need to understand what a colleague is going through. Even if it's not a colleague, it could be a sister, it could be a friend. You need to understand this and be an ally. So this is a questionnaire by Handpicked. We'll talk about this a little bit later when I talk about training resources. Handpicked is a leading provider of menopause workplace training in the UK, and they're known for their accredited programs. It has delivered extensive training to UK employees, but also outside the UK, including UK government departments. And this is something that you can find online. A few hacks: use technology to set up more reminders on your phone. Master the art of a pause when you've got brain fog, and use a fan for all seasons. And yes, there is light at the end of the tunnel. We want to wrap this up on a positive note. And according to a recent research by the Harvard Business Review, women aspiring to senior leadership roles face persistent gendered barriers. And women often encounter a steeper climb than men, as we know, especially during midlife when menopause symptoms start kicking in. Hot flashes, brain fog, this can further complicate their career. And knowledge is key in overcoming this ignorance and stigma. So this study interviewed menopausal women in senior leadership roles across the United Kingdom, the United States, and Canada. And these women actually spoke about thriving during this life stage, using their experience to build their inner strength and develop new skills. Menopause became a catalyst for transformation for these women, and they actually referred to this as a hero's journey, where they sought answers, they battled stigma, and they improved systems for future leaders. So think that all of this work that we are doing now, in our 50-some, we're helping the people who are in their 30s and 40s now. So advocate yourselves, for yourself is very important. Research, challenge misconceptions. If you go to your doctor and he says it's just a phase that, you'll go through, or, go take antidepressants, just keep asking more and more questions. If you're not happy with that doctor, there's other doctors out there. Build a better support system. The more we share our personal stories, I think the easier it is for other people to share their stories. And gain confidence above all. The more you talk about it, the more you educate yourself, the more confidence you gain. These are worth noting, the training opportunities, because both women of a certain stage and handpicked have ample resources. A lot of it is free. And what I want to highlight here is that the first one, the free menopause, the basics, it goes on for 3 days. You need to register for it. It's only half an hour, so you can easily do it during a lunch break. You can do it with other colleagues as well. Then there is a free Become the Go-To Menopause Expert. This is what I did for 3 days before gaining my accreditation. And then the other two, Menopause Champion training and Menopause Coach training, are paid. What I did is the Menopause Champion training. And Handpicked has a lot there as well. I was talking to a friend who's a designer, and I said, you do all these things with animals, with cows and bunnies, and you've never done anything with regards to menopause. And she asked me to explain my experience of menopause. And I gave her, this is not my quote, by the way, it's the eggs that expire, not the hen. And this is what she created. So remember that it's the eggs that expire and not the hen. So be kind to the hen because she's worthy. Reclaim time for the hen and start saying, I'm not available a little more often. Embrace this challenging phase and navigate your second act of life with grace. Own this second act brilliantly. Educate yourself, speak candidly and unapologetically about your symptoms, and you will emerge stronger and more badass. Thank you very much for your time.
Thank you, Mahi, for your inspirational talk and for sharing your personal story. We'll have a short coffee break now for 10 minutes, and then we'll return for our exciting panel discussion where you'll also get a chance to ask all your questions. Thank you.